Today we're going to demonstrate our repair of a complex meniscal tear. This is a high-level soccer player who unfortunately suffered an anterior and posterior radial tear. No arthritic changes previously. And here we want to attempt to do repair of both of these in order to save the meniscus if possible. We're debriding the anterior radial tear, which had around 5 millimeters of gapping. Following this, we'll use a ball rasp and then repeat shavings. This will irritate the capsule and improve healing potential. Once we complete this, we'll place a passport cannula, and then we'll use a Smith & Nephew passer to pass a tape suture in an inverted horizontal mattress fashion. So we'll flip the guide around. Following this, we will test to see whether there's good circumferential compression. In this situation, we will use the meniscal root guide to place a tunnel appropriately between the two tear components. This will allow us to bring this into a tunnel, which has demonstrated the best biomechanical fixation. Following this, we'll pull the stitches through the tunnel in this inverted horizontal mattress fashion. And in this situation, we thought it was necessary to add a ripstop stitch. So we used the new FastFix 360 with a higher bendable curve. Here we're placing one end above the stitch, and then we'll place the other end on the other side below the stitch. This causes a crisscross formation in a ripstop to prevent pull-out and improves the trajectory of the suture strength. You can see here we're sequentially tightening this, and then we'll further tighten down the tunnel stitch. In order to get our production and to improve our compression, you can see here we're reducing the tear with our probe, and then we are further tightening down in the tunnel. This will further compress when the knee is in extension for the first 2 weeks of recovery. Following this, we turn our attention towards the anterior tear. This can be a more challenging tear. We do this as an inside-out method. We're using an Arthrex zone-specific navigator and suture tape needles. This can be quite helpful. As you can see here, we can accurately pass these sutures through. This was a very unstable tear, and so we decided to perform 3 separate suture passes. These are all retrieved out the lateral portion of the knee, and then we will identify them and tie them over the capsule. After the completion of the 3rd stitch, there was adequate compression, and we then sequentially tied them with the knee at 45 degrees. This is the final fixation construct. We've repaired both the anterior and posterior radial tears in this young patient. Then we'll perform a microfracture of the notch to further improve healing.